All right. So this is the question. Question number 1. Statement: the patient was advised to gradually taper off the medication over the next 2 weeks. So this is the statement. The question is, what does taper off most likely mean in this context? Okay, so this is the statement. So read very carefully, understand the statement, and choose the answer option. Type your answers in the chat box. Okay, so no one is going to judge you if you get an incorrect answer. Everyone participate. We learn from our mistakes. So is it answer option A, B, C, or D? What does taper off most likely mean? Okay, so we have C, C, C going on. The patient was advised to gradually means slowly taper off the medication over the next 2 weeks. So what will be the answer? So shall I show you the answer? So the correct answer option is C option. Okay, taper off. Okay, taper off basically means to reduce the dosage slowly. Okay, reduction, slow reduction. That is what we call as taper off. So for example, if the patient is taking 100 mg, then from 100 mg, they have to slowly bring it down to maybe 75 mg. And from 75 mg to 50 mg. And from 50 mg to 25 mg. And from 25 to 5 mg. Okay, so that is what we call as gradual reduction, slow reduction. That is what we call as tapering off. Okay, so this is a phrase that you can expect in the OET medical vocabulary. Vocabulary is very important. Okay, so I'm trying to help you develop your vocabulary skills. Okay, so again, everyone attempt. Okay, it doesn't matter if your answers go wrong. You will be learning from your mistakes only. Okay, so taper off means this. So now let's go to the second question. Okay, so everyone ready? So this is the second question. The phrase, it's a wait and see situation. Okay, so here the phrase is, it's a wait and see situation. In a medical context, most likely what does it mean? Is it answer option A, B, C, or D? The doctor is ignoring. Condition requires immediate surgery. No action will be taken until further developments occur. Patient is discharged. Right. So what could be the answer? What's the answer to the second question? All right. So everyone has chosen answer option C. Yeah, so C is the answer. Okay, so very good. Okay, so it is a bonus. Okay, so if we participate and if we get a correct answer, it is just a bonus. If it is a wrong answer, it is a lesson. Okay, so in both situations, we win. Okay, so what is the person saying? It is a wait and see situation. So we don't know what the future could be. The future is unexpected. We have to wait and see what happens. Okay, so that is no action will be taken until further developments occur. Okay, that is in the future. Okay, in the future, presently no actions will be taken, okay, until in the future any developments occur. So it's a very straightforward simple question. Okay, so now let's go to the third question and then we will have a discussion regarding reading part C. All right, so this is the third question over here. The consultant remarked means said, her response to the treatment has been encouraging, but I would not get ahead of myself just yet. So this is a figurative speech. What is the attitude of the consultant? So here you have to identify the attitude. Okay. What is is it a positive attitude? Is it a negative attitude? Is it a neutral attitude? Dismissive means to ignore. Sarcastic means to make fun. Indifferent means basically, to have no feelings, that's all. So you have to know the right vocabulary. Okay, so the consultant is saying her response to the treatment has been encouraging, but I would not get ahead of myself just yet. Okay, so here I will teach you something called contrast phrases. Okay. All right. So the right answer option is basically B option. Confident and cautious. Confident but cautious. See, the word confident. Confident is a positive word, right? Confident is basically something that is positive. Okay. Positive. Okay. We can say it as a positive thing. Now, what is the word cautious? Cautious means a warning. Okay. We are giving a warning. You have to be careful. So that is a little bit negative. Okay. Confident but cautious. So if you take a look, okay, so those who are completely new over here, if you take a look into the sentence over here, what do you see? You see a statement, okay, and what is the statement telling? Her response to the treatment has been encouraging. So don't you think this is a positive information? Okay, her response to the treatment has been encouraging. Okay, so it is a very good, a very positive response to the treatment. Okay, so we can say that is a positive information, right? Now suddenly you see this word over here, and what is that word? The word but is coming. Okay, so this word over here, the word but in OET language, it signals a change. Okay, so the word but is one of the most common contrast phrase. So those who are completely new to this, make a note of this. Okay, it is one of the most common contrast phrase. Contrast means opposite. Okay, so we say contrasting colors, black and white. Black and white are contrasting colors. Green and red. Green and red are what? Contrasting colors, right? So contrast means direct opposite. Okay, so this word over here, contrast phrase. And what are contrast phrases? Contrast phrases are words that signals a sudden change. Okay, so in OET listening and reading and all, this will be very, very important. Okay, so when the speaker or when the writer wants to bring a sudden change, to the information that is from positive to negative, there will be a signal. Okay, and that signal is what we call as a contrast phrase. And there are several contrast phrases like however, although, even though, okay, moreover, something like that and all. But the most common is but. Now you see over here, her response to treatment has been encouraging. So that is positive information. Now the word is but is coming. So if the word but is coming, then without a doubt, you can say this is going to be a negative information. Okay, so I would not get ahead of myself. Okay, so that means I am going to be cautious. Okay, right now, her response is very good. Treatment is going very, very good. However, I'm not going to be very positive. I'm going to be very cautious. Okay, I would not be overconfident. So that is a negative information. Okay, so from positive, sudden change to a negative information is coming. Okay, and how did we find that? By giving importance to contrast phrases. Okay, so detailed lectures and all we'll be having later on. So these are for the new students. Okay, so that is it. Okay, so here, what is the attitude? And contrast phrases will help you to identify the attitude of the speaker. Okay, so see, the speaker is not saying, yeah, I am actually feeling very cautious, but we are able to understand that is the attitude of the person. Okay, and we are able to identify that just by giving importance to contrast phrases, that is but. Okay, so you can make a note of it. Okay, very good. Everyone has chosen the right answer, right? So now let's go to the next question. I think it's the fourth question, right? Okay, so this is the fourth question. Okay. The doctor noted that the patient's condition has plateaued after initial improvement. What does this most likely mean? So this is a vocabulary question. The patient's condition has plateaued. So what is the meaning of plateau over here? For this, you have to have some knowledge regarding graphs. So this is a tough question, not an easy one. Okay. All right. So the right answer option is B option. Okay. So let's see why B is a little bit more appropriate over here. Okay. So as you can see over here, the doctor noted that the patient's condition has plateaued. Okay. After initial improvement. Okay. So improvement basically means what? How does so for example, let's draw a graph. Okay. So let's draw a graph over here. So this is the y-axis and this is the x-axis. Okay. So in school and all we have written, right? So improvement. Okay. Now, for example, improvement means what? How will the graph grow? The graph will go like this, right? Improvement means what? Increase, improvement. Okay. Now, if there is so once we reach a certain level, then that is the maximum. So for example, 0 to 100 percentage. Okay. More than 100, is it possible to go? No. Okay. So when something reaches the maximum, then it will stay stable, right? Then there will be no improvement. Then there will be no improvement. At the same time, there will be no decrease as well. So there is no decrease. There is no increase. It is stable. It is steady. Okay. So there is no more fluctuation. Okay. So that is the meaning of plateau over here. Okay. So after improvement means there was an increase and now maximum improvement has been achieved. Okay. So now the patient's condition is stable. Okay, now it is steady. Okay, so that is the meaning of plateau. So here you have to know it is that's why I told you little bit graph. Okay, certain graphical knowledge if you have, it is better. Okay, so it's an advanced word. This has been repeated in OET. I remember that. So this vocabulary will definitely help you out. Okay, so good. Okay, so sudden decrease will not come because plateau basically means stable. Okay, it has reached its ultimate peak. Okay, so now let's go to the last question for the day. And then we will have a discussion regarding reading part B. Okay, so whenever you come across like interesting words like this, you can always note it down in your notebook. Okay, so that in the future, maybe in speaking, maybe in writing, or even listening and reading, you can easily approach the exams. All right, so let's take a look into the fifth question over here. So this is the fifth question. During a consultation, a patient says, it's been like clockwork, same pain, same time, every morning. What does this figurative expression suggest? It's been like clockwork. So imagine a clock. Right. So everyone has chosen answer option C. Okay, very good. All right. So that is quite impressive. The answer option is C. Okay, that was not an easy question actually. Okay, that was actually a tough question. Okay, so here, what is the patient saying? Okay, so when you are reading a statement, you must be able to identify the attitude. Okay, you must be able to identify the opinion, the perspective of the patient or the writer as well. So here the patient is saying, it has been like clockwork, same pain. There is no reduction in pain. Same time, okay, every same time, the same pain every morning. So you look at a clock. Okay, so if the clock, what it does, it goes in one uniform cycle. Okay, it goes, very uniformity is there. It is very regular. Okay, so it is very much predictable. Okay, that is the thing. So here, when the patient wants to express, okay, the patient's symptoms are very regular. Okay, it is very consistent. It is basically the same thing. So in OET we have, I mean, in English we have figurative speech. Okay, figurative speech or figurative expression. Okay, that is we use certain phrases to express our points. Okay, so those who are little bit new to figurative speech, I'm giving you a small assignment. Okay. So that is just research a little bit regarding figurative speech. Okay. And under figurative speech, you can expect something called idioms and metaphors. Okay, idioms and metaphors. Okay, so it's a small assignment. Those who are a little bit quite relatively new to the figurative speech and all. So just go to Google and just type in what are figurative speeches, what are idioms and metaphors. And the more you practice OET, the more you will be exposed to figurative speech and you'll be improving your vocabulary skills like this. Okay, so small assignment. Those who are interested. So it's a very interesting topic, figurative speeches. Okay, so very nicely done. That was the end of the multiple choice questions. Okay, so now everyone is ready to participate. Okay, and that is what we need. Okay, so now everyone's brain is active, and with that active mind, what we are going to do, we will be discussing reading part B today. Okay, so let's take a reading question paper over here. So in OET reading, there will be total 42 questions. Okay. And there will be three parts. Okay. We have reading part A. Okay. That is, there will be 20 questions in reading part A. We'll be discussing reading part A in another class. And then we have reading part B. In reading part B, how many questions will be there? There will be 6 questions. Okay. There will be total 6 questions over here. And all the 6 questions are going to be multiple choice questions. Okay, multiple choice questions over here. And each question will have one separate or one specific paragraph over here. So you have to read the paragraph, you have to understand the paragraph. Okay, you have to understand the question and you have to choose the correct answer. And a very good news is there is no negative marking. So if you choose an incorrect answer option, do not worry, they will not reduce your scores. Okay, so like this, there will be 6 questions and all 6 questions are going to be completely different from each other. So your brain will become very tired. See, for example, one day so for example, the first hour you're learning botany, the second hour you're learning zoology, the third you're learning social studies, the fourth you're studying mathematics, the fifth you're studying Hindi. What is going to happen to your brain? Your brain is exposed to different topics, suddenly. So the OET is designed. So why does OET do this? OET is very cunning. You must never expect the OET to be a very innocent examination. These people are very cunning. They're very brilliant. Okay, so here they are trying to exhaust you. Okay, they're trying to deplete you of your mental energy. And that is the reason why. That is the reason why. So those who have written the OET before, one main reason why you find part C difficult. So by the time you reach reading part C, that is, you finish listening part A, listening part B, listening part C, and then you do reading part A and reading part B. And then when you do reading part C, the reason why many students struggle with reading part C is not because reading part C is very difficult. It is because they have depleted a lot of their mental stamina. Okay, so a lot of strategies. So OET is a game of strategies. Okay, you must have the right strategies with you. If you have the right strategies, then you will be able to save your time and save your energy, and you can keep yourself focused on the question paper. And even if you're tired, even if you're nervous, you will be able to push yourself through. Okay, so we will discuss reading part A and reading part C on another day. All right, so now what we're going to do is we will be discussing few questions in reading part B. Okay, and I want it to be a very interactive session. Okay, so therefore, I will definitely be giving you the right guidance. I'll be giving you the right tips, the strategies, and all that. But before that, I want everyone to find the answer to the first question on your own. First, you try to do this question on your own, and after that, I will be giving you the explanation. Okay, so this is the question. So, everyone, read the question, read the answer options, okay, and then read the text over here, and then you type your answer in the chat box, and then I will begin with the teaching. Your time starts now. Right. All right. So yeah, so those are found the answer. You can type it in the chat box. So now the number one thing, okay? So when it comes to OET reading and when it comes to OET listening, remember your IQ levels, your intelligence quotient is being tested. Okay, so if there is just one single word that I want you to register into your mind, it is this word, strategist. So who wins the OET? Who passes the OET? The student who passes the OET is the student who is a strategist. Okay. See, for example, knowing how to play football, knowing how to play cricket, knowing how to play chess, knowing how to play any game. Okay. Everyone knows the rules and regulations of the game. But which team wins? Which person wins the game? The person who has the right strategies with them, the person who understands their opponent. Okay. They understand their opponent, they understand the tricks, the traps of the opponent, and they cunningly navigate through them, avoid falling into those traps. Okay, they know their own weaknesses, they know their own strengths, and using certain strategies, they implement the right technique, and that is the person who wins the game. Right. So similarly, when you're dealing with a question in listening on reading, you have to see this as an opponent. Okay. So here it is you versus this question, right? Not in a bad sense, not you should not see the OET as an enemy. It is a rival. Okay, so a very healthy rivalry. So this is your opponent, and your duty over here is to crack this opponent. So simply knowing English, okay, I have to choose the correct answer option. That is not enough. You must have the right strategies with you, and you have to be a strategist. Okay, so first one and the most important thing over here is that obviously you need to have good time management skills. Okay, so we'll be discussing how to manage the time later on and all, right? So that is one thing that you need. And as I told you, the reading part B, okay, reading part B, it is designed to make you tired. Okay, the reading part B, by the time you finish reading part B, the OET people want you to be completely exhausted so that when you start reading part C, you don't have any energy. Okay, so you must save your energy. Okay, so the strategies that you're implementing, it must not only save your energy, at the same time, it will save your time as well. So time management is important. At the same time, you must save your energy as well. Okay, so I will be telling you exactly how to practice the OET in this particular manner. Right. And another thing that you want to keep in your mind is certain these three words: comprehension, retention, and detection. Okay. So now you may be curious, how can we save time? How can we save energy? What strategy should we bring? Okay. For that comprehension, retention, detection, you have to know. I'll tell you what it is. And another thing is that you always have to prioritize the question. Okay. So these four things over here. Okay. These four things I will quickly brief out, and then we will have a discussion regarding this question. Okay. So those who are new over here, tell me, to pass the OET reading, what do you need? To pass the OET reading, what do you need? You need maximum number of correct answers. Yes or no? You need maximum number of correct answers to pass the OET reading. Now, how can you get maximum number of correct answers? By writing the correct answers to the questions. Okay, so you need to understand that OET people, they are not giving you marks for reading the paragraphs. The name of the test is reading, but they are not giving you marks for reading this paragraph over here. The OET is giving you marks for finding answer to the question. Okay, so what you should do, you must always prioritize the question. Okay, do not prioritize the paragraph, because if you prioritize the paragraph, of course, you will be able to find the answer. But what is your duty? Your duty is to find the answer in limited time. You don't have unlimited time. So you in limited time as well as with limited energy expenditure, you need to find the answer. So for that, the right strategy is to never prioritize the paragraph. Of course, you can find the answer, but if you want to find the answer with minimum time, with minimum energy expenditure, then you have to prioritize the question. Okay. So that is one thing you have to know. And when you're prioritizing the question, you have to first of all understand the question, because if you do not understand the question, then there is no point in reading the paragraph. So understanding the question is what we call as comprehension. So what does comprehension means? Comprehension basically means understanding the question. Okay. And how to understand the question, I will tell you. And once you have understood the question, next comes retention. Retention basically means what? Registering this information to your memory. That is, you must not forget what you understood. Once you have read the question, once you have understood the question, you must register this information to your memory. That is what we call as retention. Okay. And with the memory of the question, so the memory of the question is very thorough in your mind. With that memory, you must go and detect the answer. So you're reading the paragraph with an aim. Okay, there is an aim in your reading. It is not aimless. Okay, never read the reading without an aim. Okay, okay. So never do aimless reading. Aimless reading will only destroy your time as well as your energy. But reading with an aim, reading with a focus will help you to conserve your time and energy. And you will thank me when you reach reading part C. All right. Now, two more things I just want to tell you. That is, when it comes to comprehension, there is one strategy called keyword analysis. Okay, what is it called? It is called keyword analysis. That is, you are identifying the keywords in the question, you're linking the keywords together, and with that strategy, you're understanding the question. So keyword analysis is a very, very important, skill over here. And what type of question are we dealing with? Now here, what type of question it is? It is a multiple choice question. It is an MCQ question, right? So here your strategy is supposed to be the elimination strategy. Okay, so what strategy you have to focus over here? It is called the elimination strategy. So there will be easy questions in OET and there will be difficult questions in OET. Okay, if it is a difficult question, if it is a very advanced level question, which we can definitely expect in OET, then you must try to bring in the elimination strategy. Elimination strategy basically means trying to eliminate the incorrect answer options. That is, instead of finding the correct answer, you are focusing on eliminating the incorrect answer options. So even a difficult answer becomes easy. And there is a very shortcut method to do the elimination strategy. That is what we call as the verb analysis. Okay. So very quickly, before we have a very detailed skill discussion regarding the first question, let's talk about verb analysis and keyword analysis. And then I have prepared a document, and then we'll go to that document, and then we'll have a detailed discussion of that particular thing. All right. So now let's just first and foremost read the question over here just once. Okay. And then we will take that particular document. So what is the question over here asking you? The question is asking, nursing staff can remove a dressing if. Okay. So here there is a nursing staff and the nursing staff are allowed. Okay. They are allowed to remove a dressing from the patient if. So if basically means what? A situation. So what is answer option A? It is a situation. Answer option B, a situation. Answer option C, a situation. So in this particular situation, the nurse is allowed to remove the dressing. Okay, so let's understand what is situation number one. Okay, so if the patient situation is this, that is a member of the surgical team is present. Okay, so there is a surgical team. Okay, the surgeons over there, and at least one member. Okay, if at least means one. So if at least one member of the surgical team is present, then the nursing staff can remove the dressing. What is situation number two? Situation number two is this. There is severe leakage from the wound. Okay, so the patient is having a wound, and if there is a very severe leakage, very intense leakage is happening from the wound, in that situation, the nursing staff is allowed to remove the dressing. Okay, answer option C. They believe that the wound has healed. Now you tell me, who is this they referring to? Very quickly, everyone type in the chat box. Who is they over here? Who is they? Because these type of reference words is very important. I'll give you 10 seconds time. Everyone, who is they over here? Okay, very good. Sindhu has written staff, right? Very good. Okay, so the staff over here. Okay, yeah, very good. Nurse. Okay, okay. So the OET in again they'll try to trick you and all. So instead of writing the staff believe, the nurses believe, they will try to say they. Okay, so sometimes so here luckily only the nursing staff they have mentioned. Sometimes there will be another party involved and all. So in those cases, you have to clearly identify. So here the nurses believe, and what do the nurses believe? That the wound has healed. So situation number 3. Okay, then the nursing staff can remove the dressing. So this is what we call as keyword analysis. So what we have just done is comprehension. So comprehension means what? Understanding the question. And why is understanding the question the main priority? Because your duty is to not read the paragraph. Your duty is to find answers to the question. Right. So you have done the keyword analysis. Now remember when I told you the elimination strategy? Okay. So that is your main strategy should be to not focus on finding the correct answer. You must try to eliminate the incorrect answer options. Right. So let's discuss something called as the verb analysis. Okay. So verb analysis, verb means what? What is a verb over here? Okay, so very quickly, let's just understand what a verb is. So in English, we have nouns, okay, we have adjectives, okay, and we have verbs and all. So nouns and adjectives and all, we'll have a discussion later on. Here, what we need is verb. Verb basically means any kind of an action or movement is what we call as a verb. Okay, and 90% or 80% of the time, okay, the verb analysis can be applied in multiple choice questions of OET. Okay, so let's identify what are the verbs in answer option A. So here, what is the verb in the question? Nursing staff can remove a dressing. Right, so that is the main focal point of the question over here. So remove, okay, removing is the action over here. Okay, so this is the main verb over here. So removing the dressing. Okay, remove is the main focal verb over here. Now let's come to the answer options. Now let's try to identify if there are any verbs in answer option A. So what is the answer option A? A member of the surgical team is present, right? So the word present over here, okay, a presence of someone, that is an action, that is a movement. So that is the verb over here. Okay, so now you try to link the verb to the main focal point of the question. Okay, so if the one member of the surgical team is present, in that situation, the nursing staff can remove the dressing. Now, what is the verb in answer option B? There is severe leakage, right? What is the verb over here? Severe leakage, right? So if there is severe leakage, so that is the verb over here. In that situation, the nurse can remove the dressing. Understand? Okay. So maybe I'll just focus on just one single verb. Okay. So remove is the main verb here. So it becomes easier. Now, what is the verb in answer option C? They believe that the wound has healed. So what is the action over here? The wound has healed. So in that situation, the nursing staff can remove the dressing. Now you see over here, this is how you bring in the keyword analysis and the verb analysis. So it becomes much more easier for you to remember the question and also to eliminate the incorrect answer options. Okay, so if a surgical member is present, they can remove. Severe leakage, they can remove. And if they believe the wound has healed, they can remove. Okay, so this requires a little bit practice. Okay, from day one itself, you will not be able to bring in, but slowly, this will definitely help you out. So like this, you comprehend the question. Of course, you have to do it a little bit more quickly and all. Okay, you will definitely be able to do that. And like this one, you have once you have comprehended the question, now what you must do, you must practice retention. That is, now you must register this information to your memory. Now you must not forget the question. Okay, so now the memory of the question is thorough in your mind. Okay, so what is the question over here? The nursing staff can remove the dressing. Okay, so with that memory solid in your mind, with that memory intact, you have to read the text over here. Okay, now I'll tell you the advantage of reading the question first. So just imagine, sometimes it is very possible that the answer will be in the very first sentence itself, or maybe the first two sentences. This is very common. Sometimes the answer will be in the last sentence. Sometimes the answer will be in the beginning sentence itself. So imagine maybe the answer is in the very first or the second sentence. So in that situation, if you have already read the question, then there is no need for you to waste a lot of time and energy reading the third, fourth, and fifth sentence, because you have already read the question, and in the very beginning itself, you have already found the answer. You have confirmed the answer. So, like that, what you can do, you can save time and you can save energy. Or even sometimes, maybe the first one or two sentence, there will be an incorrect answer option. So let's imagine that answer option C is a wrong answer option. Okay. And the first sentence itself, or the first two sentences itself, they are clearly telling the opposite of answer option C. So what you have done, before you have even started reading the third sentence, you have already eliminated one answer option. Now there is just 50-50 chance. Now it is A or B. Okay, so like that, you have so many advantages of reading the question first. So that is why I always recommend you read the questions first and then the paragraph. Again, I'm trying to tell you, reading the paragraph first and then reading the question is also effective. You will definitely find the answer, but your duty is to find the answer in limited time and without unnecessarily wasting your energy, which you need for reading part C. Understand? Now let's just read this particular question very quickly, and then let's go to the skill document that we have prepared. Okay, so now we have the memory of the question in our mind. Okay, with that memory, let's read the question. And as we are reading the paragraph, here also you have to bring in the keyword analysis. Post-operative dressings. Post means what? After. Okay, so after operation, the dressings. So that is the main topic over here. Dressings are an important component of post-operative wound management. Okay, so here the document is saying it is an important, dressing is an important component. Component means what? A very important factor or an important part. Okay, a part of post-operative wound management. Any dressings applied during surgery have been done in sterile conditions and should ideally be left in place. Ideally means perfect. Sterile means very, very clean. Okay, no contamination. So you have to know the vocabulary over here as well. Okay, should be left in place. Left in place basically means during surgery. During surgery, if any dressings were applied, okay, and that those dressings, it was done in very sterile conditions. Sterile means completely clean, healthy situations. Okay, and it should ideally, ideally means what? uh, Perfect situation. The perfect situation is to keep it. Left it in place means don't remove it. You keep it as it is, as stipulated or as mentioned by the surgical team. Okay, we'll discuss this thing later on. It is acceptable for initial dressings to be removed. Okay, so here they're telling it is acceptable that for initial dressings to be removed prematurely. Prematurely means before the fixed time. Okay, so we have usually a fixed time. Okay, after 1 or 2 days you can remove the stitches, but before the fixed time we can remove the dressing in order to have the wound reviewed, or in certain situations apply a new dressing. So for reason number one, to review the wound. Okay, if you want to review the wound, or if you want to apply a new dressing, in those two situations, in those two circumstances, you can remove the dressing prematurely. These situations include Now see, now a third situation is coming. Include when the dressing is no longer serving its purpose. No longer serving its purpose means what? What is the purpose of a dressing? To protect the patient. Okay, so now the purpose is not being fulfilled by the dressing. So in that situation, we can remove the dressing. Okay, that is in essence. Okay, IE does not mean that is. IE stands for in essence. In essence, the dressing falling off. So this is one situation. The dressing is falling off. Excessive exudate soaking through the dressing. Excessive. Excessive means what? Too much. Exudate basically means what? Pus. Okay. The discharge. Pus and discharge is what we call as exudate. That is a vocabulary over here. So if there is too much of leakage soaking through the dressing and resulting in a suboptimal. Suboptimal means what? The opposite of ideal. Okay. So here the word ideal over here. Ideal means what? Perfect. Optimal. Suboptimal. Suboptimal means what? Substandard. Have you heard the word substandard? Okay, substandard means what? Subordinates. Okay, means below. Okay, suboptimal means below optimal. That is, it is not perfect. Optimal means perfect, ideal. Sub-ideal, suboptimal means it is below ideal, below perfect. Okay, wound healing environment, or when the wound complication is suspected. Okay, so here it is very lucky. Okay, the answer is very straightforward and it is a little bit easy question. The answer is basically B option. Okay, but however, let's try to discuss this particular question a little bit more detail. Okay, because the right skills are very important. And the second question that we'll be discussing here is a slightly difficult question. Okay, so let's take this document over here. Right. So this is the question. Okay, the nursing staff can remove the dressing if, and the correct answer is B option, like every one of you have chosen. There is severe leakage from the wound. Okay, so why is that the correct answer? Because in this sentence over here, you see over here, excessive exudate, okay, excessive editate soaking through the dressing. Now you see in this sentence, this is where the answer is located. That is excessive leakage is happening from the wound and it is no longer serving its purpose, we can remove the dressing. Okay, so it is an easy question actually, to be very honest, but the next question is not going to be very easy. Okay, so here that is the correct answer. Now, let's talk about the strategies over here. Okay, because my duty as a teacher is to not teach you English. It is basically to give you how to approach a question. Okay, when you come across reading part B, what approach, what methods, what technique you must bring in. Okay, so one of the most important thing that you have to bring in is that you have to identify what type of question we are dealing with. So when it comes to OET Reading Part B and when it comes to OET Reading Part C, there are different types of questions. Okay. So for example, we have action-based. Okay, let's begin from the very beginning. Detailed or fact-based questions. Okay, that is fact. Fact means what? An established truth. Okay, they mention you a fact. They have detailed you an information and they are directly asking you. Okay, what is the answer? Is it a true or is it a true question? So is the statement true or false according to the fact that has been given in the paragraph? So a direct question will always be fact-based or detailed type question. Okay, based on what is stated. Now, you can also expect purpose type questions. Okay, again, these are different common types of questions we're talking about. What are purpose type questions? Purpose type question means why the message was written. Okay, so here the document is writing a message over here. So here you have to reflect. So it is after reading the paragraph, you have to ask yourself, what was the reason for writing this message? Why did the writer write this document? So you have to identify why this message was written, the intent, the intention. Okay. So that is purpose type questions. Then you get main idea or what we call as gist, identifying the gist of the question, GIST. Gist basically means identifying the overall idea or the central message. That is, when you read the paragraph, okay, this is the main this is the main focal point of the message. This is the central message. This is the main idea of this message. So some questions will be gist type question. That is, they will be asking you what is the central message of the document. And these are a little bit complex. That is attitude or tone. That is, you have to identify the feeling of the writer. Okay, that is, you have to identify the perspective. You have to identify the opinion, or the attitude, or the point of view of the writer. Okay, that is a little bit advanced type questions. And there are certain skills that we'll be requiring. And then finally, you can also expect action-based questions. Action-based, that is what a person should do or should not do. Okay, the do's and don'ts. Okay, so like this, there will be different types of questions. Okay, so in this particular case, we are basically dealing with a question that is detail or fact based. Okay, so here they are giving you a fact. Okay, so giving you certain situations, right? Situation number one, situation number two, situation number three. In this situation, this is what you must do. In this situation, this is what you must not do. Okay, so this is a fact based question. A condition based, condition means situation. Okay, so in this condition, if this is the condition, then this is what you have to do. Right. So like that, you have to identify the question type. That is the first thing. So again, during your preparation phase, this idea will definitely help you out. Now, remember when I told you that the OET people, they are very, very tricky. Okay, this is an international exam. Okay, this exam this is not an Indian exam where only everyone is writing in India. Right, this is an international exam. So for example, we have Sindhu who is writing the exam on August 9th. Each and every country where the OET is being conducted, the America, the US, the Ireland, New Zealand, Australia, Singapore, Dubai, everyone of you will be getting the same listening and the same reading question paper. And that question paper will never be repeated again. Okay. And the correction happens in Australia. Okay. So this is an international examination where even English speaking countries, people who only speak English. Okay, so we speak multiple languages. For us, English is second language. But even for English speaking countries, doctors and nurses from there, they are also required to write this same question paper that you will be writing. So therefore, the OET is never going to make it very easy. You must never underestimate the OET. It looks very innocent, but there's a lot of trickery behind it. You must always be prepared to face any tricks of OET. Okay, so one of the most common ways they do it is by giving you tricky vocabulary. Okay, so when you read certain phrases or words from the question, you must be able to identify certain synonyms. Okay, so let's take a look into the common. In this particular question, we read some phrases or words. So let's see what are certain synonyms to that. So post-operative. Post-operative means what? After surgery. Post means after. Pre-operative. Pre-operative means what? Before. Dressings. Okay, so dressing means what? Sometimes, so if a engineer is writing this exam, they will not know what is the meaning of dressing. Okay, so for a medical professional, the word dressing basically means a thing that is used to cover wounds or bandages. Okay, so in the question, this is the word, but in the paragraph, instead of the word dressings, they will use synonyms such as wound coverings or bandages, and you must be able to identify them. Okay, so that is why reading the question clearly is very, very important. Now, there are some students, you know what they do? They will read the question just one time and they expect the same word to repeat in the paragraph. They literally expect the same word to repeat in the paragraph. Those students will definitely struggle because they are not able to identify synonyms. So here, maybe if it is the correct answer, now you see over here, what is the correct answer? Severe leakage. Okay. Now you see, is the word severe and is the word leakage or is the word wound? Is three keywords are there? Any one single word is repeated? No, it is not repeated, right? So instead of writing severe leakage, what have they written? They have written excessive exudate soaking through the dressing. Okay. So if a student is prepared to identify the synonyms, that student will be getting a good score. Right. Now, sterile. Sterile means what? Germ-free environment. So this is a very advanced vocabulary. You must be able to identify that. Stipulated. Stipulated means specified, instructed, mentioned, acceptable, permitted. Prematurely, as I told you, before the fixed time, before the expected time, if something is happening, that is what we call as prematurely. Reviewed, checked. Okay, no longer serving its purpose means what? Not working properly anymore. So you must be ready to identify these type of synonyms. Excessive exudate, too much fluid coming out of the wound. Now you see, this is a synonym over here. This is the synonym, this is the phrase used in the paragraph, but this is the alternative meaning to that. Too much fluid coming out of the wound, soaking, leaking, right? Suboptimal. Now you see, suboptimal. So so if you do not know what's the meaning of suboptimal, then it is going to be very difficult for you to find the answer. So you must be able to identify. Suboptimal means not ideal. As I told you, it is less than perfect. Sub means less. Wound complication, problem with healing or infection. So I'll be sharing this document through you after the class in our WhatsApp group. So you can, go through the correct answer. Right. So now let's talk about the skills. Okay. Now, this is very, very important. Listen to me very carefully. When it comes to the OET, okay, everyone has their own strengths. Okay, so we have six of you over here. All six of you are completely unique. You have your own talents, you have your own strengths, you have your own weaknesses. Okay, and you have your own skills as well. So you need to identify what your strengths are and you need to identify what your weaknesses are. Okay. And then according to that understanding, you need to bring in the right skills, the right strategies. Okay. So first, like for one of the most important skill that you need to find the answer to this question is the skimming. Skimming, or I wouldn't say scanning. Okay. Scanning for keywords. Okay. So it was incorrect thing over here. Scanning skills. So what is the meaning of scanning? Okay. So scanning basically means, as the name suggests, just going through the words over here, but you're not simply going through, you have the keywords in your mind. Okay, you have a list of keywords registered into your mind, and with that information, okay, with those keywords in your mind, with that, so for example, what is the nursing staff can remove the dressing. Okay, so what is the keywords in your mind over here? Allowed to remove the dressing. So that should be in the back of your mind. And with that, you are going through the content over here. That is what we call as scanning. So instead of reading each and every word very carefully, instead of reading each and every word with a lot of stress, you imprint the main keywords in your mind. Remove the dressings. Nurses, dressing, removal. So when that memory, you can just scan through the content over here. Okay, so like this, when you go scan through over here, and when you come across these words over here, um now you see the word removed. Now you see, when you reach this particular point, okay, that is the word removed over here, then you can say, okay, now I can become little bit more alert. Okay, so that is what we call a scanning skill. Scanning is not reading. Okay, so again, it is very difficult to actually say how it is. Scanning is not reading. Okay, basically, scanning is going through the words, but as you're going through, you have a solid memory of the keywords in your mind. Okay, so when you do like that, you will be able to save your time. So once again, so why am I telling this? Because I'm telling you because you need to save your time as well as save your energy. Okay, so for that, this skill is important. Synonym recognition. Okay, so once you expect certain words, once you see some words in the question, you must be able to expect and you must be able to recognize, you must be able to identify, okay, this is a synonym and this is exactly the meaning of the keyword given in the question. So that skill is important. Okay, elimination skill. Okay, elimination strategy is also very, very important. We'll be discussing that later on. And then paying attention to permissions. Okay, permissions basically, so this is a condition based question. Okay, that is when the nurse is allowed or not allowed to do something. Okay, that is not very, very important over here. Okay, so now what we're going to do is, now we are going to practice the elimination strategy. Okay, and here I'm going to bring in the verb analysis. Okay, so I know this is an easy question. Okay, but it is very important that you find the answer properly. Okay, so that is the reason why I'm going into too much detail. Okay, so let's take a look into the question over here. Okay, so we have the keywords ready over here. Now, what I'm going to do is I'm going to bring in the skills. Okay, so step number one, identify the question type. Okay, so we understand that this is a condition-based questioning. Okay, it's a fact-based direct question. It's a condition-based question. So we have identified the question type over here. Okay, and the next thing over here is comprehension. Comprehension of the question using the keyword analysis. Then what is the next step? Retaining the question, retention of the question to your memory. Okay, you have a solid memory of the question. Okay, and then it is detection, that is comprehension, retention, and then comes detection. Right. So let's once again very quickly identify the verbs over here so that it becomes easy for you to eliminate the incorrect answer options. Okay, so here what is the verb over here? Present is the verb. Here what is the verb over here? Severe leakage. Here what is the verb over here? They believe they have healed. Okay, now let's read the text, but it is not basically reading. Okay, we are basically scanning. Okay, so you have to perfect the scanning skill as well. Okay, and let's bring in the elimination strategy. Okay, so let's take a look into the first sentence. Okay, dressings are an important component of post-operative wound management. Okay, any dressings applied during surgery have been done in sterile conditions and should ideally be left in place. Ideally be left in place means don't touch it. Keep it in that same situation. Don't remove from the place because it was done during surgery and it was done in sterile conditions, germ-free environment, and ideally keep it there or as stipulated by the surgical team. Now you see over here the word surgical team is coming. So when the word surgical team is coming, you have read this word before. Okay, where have you read it? You have read that particular thing in answer option A. So now you can come to answer option A. Okay, now what is answer option A telling? That the nurse can remove the dressing if the surgical team is present. Okay, now let's keep reading. Okay, so you just glance through answer option. Let's come to the next sentence over here. Now, what are they telling over here? It is acceptable for initial dressings to be removed. Okay, now the main word is coming. The main focal point of the coming, remove over here. Now you see over here, now they're telling it is acceptable for this thing to be removed prematurely. That is before the fixed time in order to have the wound reviewed. So if they want to review the wound, or if they want to apply a dressing, the nurse can remove the wound over here. And these situations include when the dressing is no longer serving its purpose, that is dressing falling off, excessive exudate soaking through the dressing. Now, what is that verb over here? Exudate, that is a synonym. So you have to recognize the synonym over here. Okay, so that synonym is basically this one, severe leakage. Okay, that is the synonym over here. So what you can do, you can put a question mark over here. Okay, because you suspect that B is the answer. Okay, we have not read the entire paragraph over here, but just by reading over here, you have read this, you have identified the keyword, you have identified the verb over here, and they have specifically mentioned that over here as well. The same words, the same keyword, the same verbs is mentioned. Okay, everything is condition based, and you can say, okay, I suspect. Okay, this could be the correct answer. So you can put a question mark over there. Okay, so now let's read the remaining sentence and resulting in a suboptimal wound healing environment or when a wound complication is suspected. Right. Now let's come to the verbs in answer option um, A, B, and C. Okay, so let me just remove this over here. Okay, now what is the verb in answer option A? What is the verb in answer option A? A member of the surgical team is present. Okay, so here this word, see, surgical team, they have mentioned over here, right? Yeah, right. Now you see over here, what is the verb in answer option A? The main verb in answer option A is the word present. Okay. Now, have they mentioned anywhere that the nurse can remove the dressing if the if at least one member is present or not? So this verb, okay, so you are looking for the verb over here. So this verb is not mentioned. So since this verb is not mentioned, you can very easily eliminate answer option A. Right? Now, what is the verb in answer option C? The answer option C is the staff believe the wound has healed. So, is this verb mentioned anywhere? it is not mentioned anywhere, right? So what you can do, this verb is not mentioned. The word believe, this verb is also not mentioned. So since it is not mentioned, this also is eliminated. And you suspect that B is the correct answer. Again, it is very directly mentioned. So what you will do, after you have eliminated A and C, you can now confirm B is the answer and you can choose B as the right answer and you can choose B. Okay, so this luckily was a very easy question, but the next question is not very easy, I suppose. So let's see if you can do the same thing over here. Okay, so this is the technique. Okay, this is the right way to do OET reading. Guesswork. Now, please don't do, inky pinky ponky and choose the correct answer option and all. That and all in schools and colleges and all will work. In OET, it is not going to work. Okay, so guesswork and also simply blindly out of luck choosing the correct answer, it is not going to help in the long run. So once you select the correct answer, you must know this is the reason why this is the incorrect answer option as well. Okay. So let's go to the next question. The next question is slightly tough. Okay. And let's see if you're able to do this question also. So bring in the strategies that I discussed with you. So let's see. Okay. So first I want you to do it on your own. So this is the question. Okay. This is a question over here. So first you read the question, bring in the strategies I told you. And once you have done that, you can type your answer in the chat box. Right. Okay. So this is the question over here. Okay. So first, I think let's just discuss with the document first, and then we will come to the, this thing. All right. So this question over here. Okay. This is basically the correct answer option is A option over here. Okay. So the answer option is basically A. As explained in the protocol, the position of the RUM container will ideally, the correct answer option is A. So those who have chosen answer option A as the right answer, good. Those who could not find the answer, no problem. We learn through mistakes only. Okay. So encourage participation in this scheme. So we will definitely come to an understanding why A is the answer. But again, we don't want anyone choosing the correct answer out of luck or out of guessing. Okay. Because this is OET we are speaking about. So therefore, it has to be very thorough and perfect. Okay. So let's, as a teacher, let me give you the right strategies Okay, the right skills so that you develop the right preparation methodology. So what type of question? As I told you, there are different types of questions in OET, right? Okay, so we discussed about attitude type questions, main idea, that is the gist, factual type questions, okay, outcome, consequence, okay, that is consequence type questions, purpose type questions and all. So in this particular type of a question over here, it is a purpose type question. Okay, it is a purpose. Okay, purpose means what? Reason. Okay, why? Purpose means WHY. Why? Okay, why this was done. Okay, so this is the purpose. So here you have identified, okay, this is a purpose type question. So here, if to find the correct answer, you must think like this: why this has been done. The WHY is the most important thing over here. Okay, so it's a purpose or function based question type. It tests your understanding of why something is done a certain way. So you have to think, okay, this is the reason why, but this is the reason why it was done. Okay, and there are different types of question types in OET reading part B. Purpose type questions, that is exactly like this one. That is why something is written or positioned a certain way. So you have to think. You have to think the reasoning behind it. Okay, so like this. So the thing is, if you're able to identify the question type, then you can bring in the right approach. Okay, this is the approach that is the most suitable for this question type. Okay, so that is the reason why identification of the question type is very important. Okay, so on the previous question, what was it? It was not a why question. The previous question was a factual question. It was fact based. It was condition based. Okay, it was more direct over here. Okay, and then we have, as I told you, gist type of question, GIST. Meant is the overall message, the central message. That is the main idea. And then you can also expect attitude type questions. That means you have to think like the writer. You have to understand what is the feeling of the writer. So if it's an opinion type question, then the complete strategy will be suitable to that. Okay, outcome or consequence. That is this future based outcome or consequence basically means a future based question. That is, in the future, this will happen. Okay, what might happen if something is done or not done. So that is completely future based questions. So sometimes the tense usage also plays a very important role. Right. So now let's talk about the tricky vocabulary. So when it comes to the OET and all, there are certain tricky vocabulary, because they're very cunning people. So let's just again very quickly, I will be sending this document to you through WhatsApp. So no worries. So let's just talk about the difficult vocabulary and certain synonyms, because synonym recognition, okay, when you're coming across the skills over here, synonym recognition is very important. Okay, so they have written on there, means returned unwanted machine. Dispensing means what? In a pharmacy, who dispenses the medication? The pharmacist. Okay, that is the meaning of dispensary. So the location where medications are dispensed. Okay, so dispensary means not a person, a pharmacy, a location where dispensing happens. That is what we call as dispensary. Okay, where medicines are stored, or an area where dispensing happens. Enclosure. Enclosure means a closed off area, a very restricted area. That is what we call as enclosure. Public does not have access. Basically means what? It is a restricted area. Okay, visible position. Visible means what? Okay, we'll be reading through the passage, so you will be able to understand. Visible means it can be seen. It is noticeable. So in the question, these words will be there, but maybe in the paragraph, instead of visible, they will write such words such as this. Okay, noticeable, seen, out of reach. What does out of reach? So when you're calling someone, the person you're trying to call is out of network area. It means out of reach means what? They cannot be accessible right now. They cannot be touched right now. Okay, it cannot be that. It's a little bit far away. Okay, this thing is a little bit far away. It cannot be touched, or it is not accessible. Reinforce. So this is one of the most common verbs I see in OET reading. Reinforce. Okay, even in speaking also this word comes. Reinforce basically means to remind. Okay, to remind someone, or to very strongly state an idea. Okay, so reinforce. See, force means what? To push. Okay, so when we want to push an idea, when we want to say an idea very strongly, we use the word reinforce. Okay, returned medicines will not be recycled. What does that mean? Okay, that means it will not be recycled once again. Okay, that means it will not be reused. Encourage participation. Encourage participation means what? Motivate people to take part. Okay, that is the thing. Okay, so again, there are certain skills over here. In this particular question, what skills do you need? This is a purpose type question. Purpose type question means what? They're asking you why. Why is the reasoning over here? So in this particular question, you need to have purpose identification skill. If a student is really good in English, but if the student is not able to identify the purpose, identify the why, identify the reason, then they will really struggle. So purpose identification skill is important. See, that's the thing. For each and every question, a separate skill set is important. Okay. And then once again, the elimination strategy. Since we are dealing with multiple choice questions, the most important strategy is the elimination strategy. That is very important. Okay, paraphrasing. Paraphrasing means expecting synonyms, synonym recognition. That skill is important. Attention to detail and avoiding traps. So in OET, there are so many traps, and you have to be very careful to avoid the traps over here. Okay, so now we know that answer option A is the answer. Okay, and we have gone through the synonyms list and all that. So now let's talk about comprehension, retention, detection, keyword analysis, verb analysis, and let's perfect the elimination strategy. Okay. So let's understand why A is correct and why B and C is wrong. But first and foremost, we need to comprehend the question. So let's do that. So here the question is telling, as explained in the protocol, the position of the RUM container will ideally, okay, position, okay, position means what? One particular location. Okay, in this particular location, you have to position this. Okay, that is the meaning of this particular thing. So this RUM, that is returned unwanted machine. Okay, that is the meaning of RUM. So unwanted machine which was returned. Okay, now it's coming back to us. You have to keep it in one particular location or in one particular situation. Okay, and in that situation, it will cause an ideal situation. Okay, it will ideally, ideal means what? Perfect. The ideal man, the ideal woman means what? The perfect man, the perfect woman, right? So in this particular situation or position, it will function very perfectly. Okay, so it will ideally, it will ideally encourage participation in the scheme. Okay, so here the machine, if it is positioned like this, then in a perfect situation, it will encourage participation. Okay, encourage participation in the scheme. Okay, that is again. So let's just do the keyword analysis. Now, keywords in answer option B, emphasize the value of recycling. Emphasize basically means to reinforce. Okay, to strongly say something. That is the meaning of emphasize, reinforce. Okay, and C, facilitate public access to it. All right. So now let's do the verb analysis, because the verb analysis is going to help you refine your elimination strategy. Okay. So what is the verb in answer option A? Okay. Let's do the verb in answer option A. So let's take the tool. So as explained in the protocol, the position of the RUN tube will ideally, okay, this is what you have to find out. Okay, so what is the verb in answer option A? Encourage participation. Okay, so this is the movement, right? This is the action. Okay, participation, or you can say participation is most the more important verb over here. That is, it will encourage participation in the scheme. Okay, so this position over here, it will encourage participation. Now, what is the verb in answer option B? Emphasize the value of recycling. Okay, so here the word recycling is the verb over here. Okay, and it will emphasize the value. That is, people will know how valuable recycling is. So if this position, if this container is kept in this position, it will make people understand the importance of recycling. Okay, now what is the verb in answer option C? What is the action over here? Facilitate public access to it. So facilitate means make it easy. Facilities. Okay, so facilities means what? Services. Okay, so facilities, that is means it makes easy for the public to access it. Okay. So that is the verb over here. So in this particular position, if it is kept, it will make easy for the public to easily access it. Now see this word over here. What does the word it refer to? So in OET, you have to be very careful when you come across these type of words. So the word it over here, it refers to the RUM container. Okay, this is very, very important. Okay, you have to link the prepositions to the correct terms like that. Okay, so now see, it becomes a little bit easy. Okay, now see, position of the RM2 container will ideally, and what it does? Participation, recycling, facilitate. Now you see, these three words should be thorough in your mind. Okay, if this container is kept like this, it will increase participation, it will emphasize recycling, and it will facilitate public access. So see, like this, it becomes a little bit easier for you to pinpoint the right answer. Okay, yes, Dr. Arora, you may leave. Right. So now let's come to the answer option. Let's come to eliminating the incorrect answer options, right? Let's try to understand why the remaining answer options are incorrect and why answer option A is correct. Okay, so again, we are talking about the right skills over here. Okay, so let's talk about the first sentence over here. Unwanted machine, pharmacy collection protocol. Now, what we're going to do is you are going to scan. Okay, you're not going to read over here. The skill is to bring in scanning method. But when you are scanning, you must remember the keywords over here. Position of the machine. Position of the machine. That should be in your memory. With that in your memory, you have to scan for the answer. Only then you will be able to save your time and energy. Okay, so let's scan for the answer. A returned unwanted machine project approved container will be delivered by the wholesaler to the participating pharmacy. The container is to be kept in a section. Now you see this word over here. The container is to be kept. So kept basically means what? Positioning it. Okay, so that is a synonym over here. So when you come to this word, your mind should become activated. Okay, so now they're talking about the positioning of the returned unwanted machine. So like that, you must be able to identify. So this is how scanning is done. Okay, the container is to be kept in a section of the dispensary. The section means what? In a particular place of the dispensary or in a room or enclosure. Enclosure, as I told you, means a restricted area. Okay, in the pharmacy in which the public does not have access. Now, what is this? Have you heard? So the word access over here, have we read it earlier? We have read it in answer option C, right? So what is answer option C telling us? What is the verb in answer option C? Okay, facilitate public access. Facilitate basically means what? To make it easy. To make it easy for the public to access it. Now you see over here what they have written. They have told you have to keep it in such a position, but that position will ensure that the public does not have access. Does not have access. So what does that mean? That is the direct contradiction. That is the direct opposite of answer option C. Okay, the verb. Okay, it is the direct contradiction. It is direct opposite of answer option C. Okay, see, now you have not even read the full paragraph, but just reading the middle of the paragraph itself, you have now eliminated one answer option. So this is what we call as the elimination strategy. So now you have 50-50 chance. You have eliminated answer option C. Now it can be either A or either B. And even if it is difficult, if you're lucky, 50-50 chance, you may get the correct answer. Right. So let's once again continue reading over here. So everyone understood why C is incorrect. Okay. The public does not have access. The position should be such that the public cannot access it. So that is the direct opposite of facilitate public access. So that we have eliminated. Right. Now the container may be placed. See, placed means what? Position. The container may be positioned in a visible position. Visible position means what? Everyone can see, but out of reach of the public. Okay, that means it should be the public should not be able to access it. So once again, it is answer option C, which is incorrect, as this will reinforce the message that unwanted prescription drugs can be returned to the pharmacy and the returned medicines will not be recycled. Okay. Now you see over here, here, what are they telling? The container may be placed in a visible position. That means you have to keep it in a position where everyone can see, but it should be out of reach of the public. Okay, that means public should not be able to access it. Why? Now you see, this is a purpose. Okay, as I told you, this is a purpose type questioning. Why? So the word as over here, as over here, what does that mean? As means because. Okay. So if I'm asking you, why were you late yesterday? So you'll say, because I had fever. Okay. As I was stuck in traffic. Okay. So these type of words, since, as, because, since. Okay. These type of words will particularly point why, why. Okay. So this is a purpose type question. So when you see over here, what are they telling over here? Here the reason is, what is the reason? As this will reinforce the message that unwanted prescription drugs can be returned to the pharmacy. Okay, so if this machine is kept over here, it will encourage people. Reinforce means what? It will strengthen the message. It will strengthen the message that unwanted medications, they can be returned to the pharmacy. Okay, so that the patients who need the medicines, okay, the patients who don't have the money to buy the medicines, for them at least we can give the medicines for free, right? So if someone does not want prescription medications, instead of throwing them away, what they can do, they can return it to the pharmacy. So at least a person who needs it will get the medication. So that message we can reinforce. Okay, so that is the main intention why this machine should be kept out of reach from the public. You understand? Like this, you must be able to think very clearly. Okay, and that returned medicines will not be recycled. Now, see what is the keyword over here? Recycling. Okay, so this is the verb we have done. But what are they telling over here? Okay, the reason is to make them understand that returned medicines will not be recycled. That is the opposite of recycling. Okay, medicines will never be recycled. Okay, so here what is B telling? That it needs, people need to understand the value of recycling. So can we choose that? So what is the verb over here? Recycling. And here what they have written? Not be recycled. So what we can do? We can eliminate. So this is the opposite of what is mentioned over here. So what you can do? You can eliminate answer option B. Okay. And we have already eliminated what? Facilitate. This also we have eliminated. So C we have eliminated. So now see B and C we have eliminated. So that means what? That means automatically answer option A becomes the correct answer. Now you see, even if you don't understand why A is the answer, this is very, very common. They will not make it extremely easy for you to understand, okay, this is the correct answer. So that's what I told you, this is an advanced type question. So in advanced type questions, even if if you find it very difficult to choose the correct answer, what you can do is you can bring in the elimination strategy. So identify the verbs, identify the keywords, scan with the memory of the verbs, scan with the memory of the keywords in your memory. Okay. And then you try to eliminate the incorrect answer options one by one. So here very easily we have eliminated C option, and very easily we have eliminated B option. So what does that mean? Automatically, answer option A will be the correct answer. Encourage participation in this scheme. So these are the strategies that you need to bring. Now see, and now you see over here, there is no need for you to read the sentence. See, you can save some time, you can save some energy like that. So is this sentence over here, there is no need for us to read it, but just for the sake of confirmation, we can just glance through it. So here they are telling needles, other sharps, and liquid cytotoxic, means dangerous products, should not be placed in the container, but in one specifically designed for such waste. So this is a distractor question. This is a distractor statement that is not going to help us in any manner. Okay, so like this, if you read the question, if you identify the keywords, you comprehend the question, do the verb analysis, okay, with a strong memory of the question, if you scan through the text expecting synonyms, and if you bring in the elimination strategy, then very quickly and very easily you will be able to choose the correct answer by confirming that as the correct answer by eliminating the incorrect answer options. And you can also save your time and energy by ignoring the useless information, right? Sometimes even 1 or 2 seconds, if you are able to save the 1 or 2 seconds in every question, if you're able to save 1 or 2 seconds, then you can have at least 5 minutes extra, right? So that is why these strategies are going to be important. Now see over here, encourage participation in the screen. Is this word, see, there are three words over here: encourage, participation, scheme. Do you see at least one word repeating? Participation is not repeated, scheme is not repeated, encourage is not repeated. And you may not even have understood A as the correct answer. Okay. But if you bring in these strategies, you can very surely choose A as the correct answer. That is the skill behind this. All right. So now there was one more information I just want to say before winding up the class. So today we discussed tetanus. Okay. So this document over here, okay, I have taken it from this question paper called tetanus. Okay. So just two very important information I want to say, and then we'll wind up the session. Okay. So the first important information is that when you're doing an OET reading, okay, so those who have written the OET before, you know, this is how your OET question paper looks like. Okay. This is exactly how your OET question paper looks like. Okay. And you can see over here, there is this logo, Cambridge Boxall Language Assessment. Okay. So Cambridge University is a British university that is responsible for making the question papers of OET. Okay, Cambridge University makes the question papers for OET. Boxall is an Australian organization. So the corrections happens in Australia. Okay, so whenever you're practicing, anytime, so especially those who are writing the exams, those who have booked the examination, please understand that when you're going to write the exam on an examination day, for example, on August 9th, you will be getting a Cambridge Boxall language assessment prepared material. Okay, and these materials, only these materials are going to test the skills I told you. Okay, so remember when I told you that OET is all about skills, the right, having the right skills with you, and those skills you will be able to develop only if you're practicing with the Cambridge University materials. Okay, so that is why in Google Drive. So in Google Drive, we have given you access. Okay, so if you click on Google Drive, you can see official reading, official listening. Okay, official listening and official reading basically means the original Cambridge University materials. Okay, so click on that and you will be able to see all the Cambridge materials that repeatedly you do. Okay, don't waste a lot of your time with the fake OET materials. Okay, so that we'll have a discussion regarding that later on. The second information that I want to say is that we have the app. Okay, so those who have don't have access to the app, let me know. So we have our own app. It is called the OET Exam Mastery App. Okay, so in that app we have very detailed recorded lectures. If, for example, for tetanus, so today we discuss reading part B. Okay, so if you just open the app, okay, and if you scroll down to reading tetanus, so for example over here, I'll just show you how the video looks like. So this you will be getting 24/7 access. You will be getting 24/7 access to the recorded lectures of listening and reading in the app. And those lectures are a little bit different. Okay, and I'll just show you how it is. So let me just open it. Okay, so for example, this is a reading part B. Okay, so as you can see over here in the app, with images, with photos, with videos and all, and even with translations in Indian languages, in very detailed lectures, we have record lectures available. So for example, this is a question that we have done, question, answer option A, B, and C. Okay, translations are there. Keyword analysis with images, photos, videos, animations and all, with translations in Indian languages. Okay, and text, we'll be discussing the text, choosing the correct answer option where the answer is located, right? Simplified terms, okay? And all these things. So if you just go through, and then explanation why B is the answer, okay? And also explanation why answer options A and answer option C's are wrong. Okay, so like this, very detailed recorded lectures for all the parts, that is reading part A, reading part B, reading part C, listening part A, listening part B, listening part C, for all the Cambridge University materials are available in the OET Exam Mastery App. Okay, so I'll be giving you access to the app for those who don't have access to install it. Right now, it is available in the Android platform. And for our students, we give complete access for free. Okay, so you can enjoy the benefits. And after you do a listening, after you do a reading, if you have any doubts, you can just log into the app, go through recorded lecture, clarify your doubts. And still, if you have any doubts, you can ask me through WhatsApp and I'll be clarifying your doubts. Okay, so like this, we'll be discussing one part almost every day. Okay, so yesterday we discussed reading part A. So today we discussed reading part B. Okay, so tomorrow we'll be discussing another part. Okay, so like this, we'll be discussing listening and reading daily. For writing and speaking, we have other trainers. Okay, so that was it. So today, let's just have a small recap of what we learned. So reading part B, 6 multiple choice questions. Yeah, thank you. 6 multiple choice questions will be there. Your duty is to find the correct answer by eliminating the incorrect answer options. Comprehension, retention, detection, keyword analysis, verb analysis, elimination strategy. Okay. So this lecture also has been recorded and I'll be sharing this record lecture in the WhatsApp group as well. Okay. So like this every day I'll be available at 9:30 p.m. and that's it. So if you have any doubts, you can just reach out to me to WhatsApp. Okay. So everyone, thank you very much. Have a fantastic night.